All right, learning plan 6 part F. This is the anti-inflammatories, and this is also the last section for this lecture. The first of the anti-inflammatories is the anti-leukotrienes, or leukotriene inhibitors. Leukotrienes are substances that are released when a trigger, such as, for example, cat hair or dust. Both of those are my problems. It starts a series of chemical reactions within the body, which results in inflammation, bronchoconstriction, and mucus production. That's like the trinity of asthma. So anti-leukotrienes are an anti-inflammatory. They prevent leukotrienes from attaching to receptors on the cells in the lungs and in circulation. Inflammation in the lungs is blocked and asthma symptoms are relieved. It prevents smooth muscle contraction of the bronchial airways, decreases mucus secretion, and decreases neutrophil and leukocyte infiltration, which prevents inflammations. It's used as a prophylaxis and chronic treatment of asthma in adults and children. It also can be used to prevent exercise-induced asthma and the treatment of allergic rhinitis. It is not for the management of acute asthma attacks. Anti-leukotrienes, such as Singulair, generic name is Montelukast, and other leukotriene modifiers, clinical studies show that they provide clinical benefits when added to an inhaled steroid. It allows for a lower dose of an inhaled steroid. Remember that additive effect. Improves forced expiratory volume, better ventilation, decreases nocturnal asthma symptoms, and generally improves quality of life. Leukoreceptor antagonists, or LRTAs, Montelukast, or Singulair. It can be used in children older than 2 years, but we need to check liver function. We want to watch for Churg-Strauss syndrome and for mental health issues. Other anti-leukotrienes, such as Zafirkalast or Accolade, we have to watch for headache, nausea, diarrhea, liver dysfunction, and Xyluton or Zyflo. Now, Churg-Strauss syndrome is a type of vasculitis, blood vessel inflammation that occurs throughout the body. The defined criteria for Churg-Strauss is high number of eosinophils, which is a type of white blood cell in the blood, pain, numbness, or tingling in the arms or legs. This is called mononeuropathy. Lung abnormalities, sinus problems such as abnormal growths or polyps, and a tissue sample that shows a blood vessel with eosinophils around it. Usually a person already has asthma when he or she develops Churg-Strauss. Nobody knows really what brings the syndrome on, but research indicates that it is an autoimmune disorder, meaning the white blood cells within the body, which usually just fight off a disease, begins to attack healthy tissues. This autoimmune disease affects males and females equally. Commonly, autoimmune diseases generally attack women more than men, but this one is fair among all sexes. How do we treat it? Well, since it's a problem with the overactive immune system, medications are given to slow down or suppress the activity. Prednisone is the medication that we usually use, but other immunosuppressive drugs such as Imuran or azathioprine, mycophenolate or Celcept, methotrexate, or cyclophosphamide, Cytoxan, may also be added if needed. High doses of medication can be given intravenously in very severe cases. Symptoms usually start to resolve quickly after starting medication, but treatment can last for 1 or 2 years, depending on how severe the syndrome was. Some of the side effects of these medications: aggression, anxiousness, dream abnormalities, hallucination, depression, insomnia, irritability, restlessness, suicidal thinking and behavior, suicide itself, and tremors. So when we give anti-leukotrienes, we're going to monitor for therapeutic effect. We should see improvement in about 1 week. We're going to ensure that drug is being used for chronic management, not for acute asthma. Always check for liver function before starting. And the medication should be taken on a continuous schedule even after symptoms improve. And then we have corticosteroids. These are anti-inflammatory which prevent the inflammation which commonly is provoked by the substance which releases from mast cells. This is the first-line controller recommended to manage asthma. It's used for the management of chronic asthma. It does not relieve symptoms of an asthma attack. It can be used inhaled or oral, and it may take several weeks for full effects to be seen. So some of the inhaled steroids, fluticasone in Flovent or Flonase, triamcinolone, acetonide or Asmacort, beclomethasone or Vanseril Beclevent. Side effects: pharyngeal irritation, coughing, dry mouth, and oral fungal infection. The most important client treatment with these medications is you have to have your client gargle and rinse their mouth out after corticosteroid use. Otherwise, you will develop thrush. The coughing, pharyngeal inflammation, and dry mouth, very common. If they develop dry mouth, sucking on hard candies helps. The coughing and pharyngeal airways, sometimes that just happens, and that's a side effect you might have to put up with to reduce the asthma effects. When you're using corticosteroids, you need to slowly taper off oral doses when you switch to an inhaled form. It's contraindicated in patients with psychoses or fungal infections from AIDS or tuberculosis. When you use inhaled steroids, you have fewer systemic effects than with oral steroids. There's also mast cell stabilizers. These are also used prophylactically. Remember, mast cells are what release histamines. So if we stabilize these membranes, we will get fewer inflammatory responses. This mast cell stabilizers are not used for acute asthma attacks. This is an adjunct to overall management. Mostly used for exercise-induced bronchospasm, and also for bronchospasm associated with cold, dry air, or allergens. Some of the side effects are coughing, sore throat, rhinitis, bronchospasm, taste changes, dizziness, and headaches. And the nursing implications, we should not use these in children younger than 5. Therapeutic effects begins at 1 to 2 weeks and peaking at 2 to 4 weeks. And like with the corticosteroids, gargle and rinse your mouth out to minimize irritation to the throat and oral mucosa. That covers the respiratory illnesses and treatments, the medications. Come to class with all of your questions. We will cover these again and practice administering these medications.